Good morning, everybody. We are demonstrating retro anchor, which is a new innovative anchor used for subscapularis repair. For beginners, to put an anchor into the lesser tuberosity is sometimes difficult, and you need to use an anchor, a portal which is way anterior, and the trajectory of the anchor is very close to the patient's eye, which may cause occasionally eye injuries also. So we have developed a new technique in which we can avoid an anterior portal. To pass the anchor for the subscap, and this anchor we have called it as a retro anchor. So we use a conventional PCL femoral aimer here, and we place it so if the patient is like say in a lateral position like this, we actually put this jig from the lateral portal or maybe the anterior portal, and we place it right at the level of the greater tuberosity like this, and we lock it like this, okay? And then this is through the posterior lateral portal, and after that we will be inserting our wire through this portal into the anterior part. So this will exit right at the lesser tuberosity. So once this drilling step will pass this needle through the jig, okay, like this, okay? And after that we will be just removing this bullet like this, and we'll be keep taking out this the jig like this. Now we can use a chia after that. So we have a tunnel which is through the humeral head and exiting at the lesser tuberosity. After that we will be putting a chia wire like this, and this can be retrieved anteriorly. After that we can use a loop-in suture. So after that we will be using a this loop-in suture. Now loop-in suture is nothing but it is a wire and which has a loop on the top. So there is a loop on the top, and this is also feeded like this, okay? So we take it out like this and pull it like this. So now there is a loop of the loop-in wire is here, and through the loop-in wire we will be passing the retro anchor. Now this retro anchor is a unique anchor. It's an all suture anchor. It has got a very good pull-out strength, and it is without any inserter. So it comes out free like this. So this is the retro anchor. So this is a pulling suture, and it is loaded with number 2 wires, okay? After that we will be putting these two wires into the loop of this loop-in suture. Now this is pulled nicely, and now we are looking from the posterior portal or the posterolateral portal, and we keep pulling like that, okay? After that we will be putting an artery or so that we are not pulling it much, and we just pull it like this, okay? And now it has gone in, and at this position this is locked. So we have an anchor which is locked on the lesser tuberosity. Once this anchor is locked, once this anchor is locked, both the two sutures are in, we can just take out this wire from the anchor, okay? So now we have an anchor which is on the lesser tuberosity with 4 number 2 sutures without the use of any anterior portals, without the use of a trajectory which is close to the patient eye, and it's a very safe approach of putting this anchor. And after that you can just use anything to close and repair the subscap as you want, but you have a good pull-out strength at the level of lesser tuberosity. So this is one of the recent innovations in the treatment of subscapularis repair, passing an anchor from posterior to anterior, avoiding anterior portals and avoiding portals which are close to the patient's eye. So it prevents any iatrogenic injury to the patient's eye. Thank you.